Another similar question to how mobile essentially will it be is how active can you be after back surgery? The answer is very active. In fact, that's the whole point of it. It's hardly worth going through if you can't improve your lifestyle. And I try everything that I can to get you there. If you think about these cages again, they were built with intent. They have a little give and take. So they have a little bit of flexibility to them, which is exactly what we want. In other words, the more you use your back, the better they heal in, the better that they work. So I encourage my patients, rather than have back surgery, get in a big old brace that we don't let you move at all. We do it kind of the opposite way. If you have to get fixed, get it done, get it right, and get on with your life. So I want people to get up. I want them to be active, out of the house, doing whatever that you really feel like you want and need to do. And you can push your back. Most of the time, this works very well.